Please recognize that you will hear a lot of good information today, but this is an information webinar, and it's not to be taken as medical advice, even when the doctor speaks. So anything that you find that of value, please take it to your own medical team and discuss it with them, and we'd sure appreciate that. Quickly, I will mention that everyone, if you would please now turn off your cameras and your microphones. Okay, you won't need them anytime during the meeting. In fact, it becomes a major distraction, especially when I get to see somebody having a real nice breakfast. So we'd appreciate if you would do that. And with that, I will then pass it along to Martin Gerwitz, who will introduce the program.
Thank you, Joe. Great job. And good day, all. I am Martin Gewirtz. I am the Secretary of the Board of Active Surveillance Patients International, and I'm so honored to be giving this short introduction on behalf of our organization. I want to extend a warm welcome to those of you who are joining in the United States and from around the globe. Many of you know that our mission extends beyond our borders, working with like-minded organizations in pursuit of our mission, empowering prostate cancer patients with information to make shared, informed decision-makings with their medical teams. We hope that today's presentation will give everyone food for thought, that pun was intended, for you to consider as you navigate your own health journeys and challenges. Prostate Cancer Awareness Month, if you don't already know, is around the corner in September, and we are so excited to kick it off today with Dr. Stacy Loeb on diet and nutritional lifestyle, with some exercise suggestions thrown in. There's much I can tell you about Dr. Loeb, but I need to keep this short. So briefly, Dr. Loeb is a professor of urology and population health at NYU and the Manhattan Veterans Affairs Medical Center, specializing in prostate cancer. Dr. Loeb completed her urology residency training at Johns Hopkins and subsequently completed a Master's of Science in Comparative Effectiveness Research at NYU. She currently has grants from the Prostate Cancer Foundation, Department of Defense, and the NYU Perlmutter Cancer Center. She has published more than 350 peer-reviewed articles and 10 book chapters, primarily on prostate cancer, men's health, and social media. There's so much more I can tell you about. You should tune into her Sirius XM satellite radio show on Wednesdays from 6 to 8 p.m. She gives international lectures, courses on prostate cancer, men's health. And again, there's so much more. I will be posting a link where you can read everything you always wanted to know about Dr. Loeb. We also intend to continue the subject matter presented today with our Saturday, September 30th webinar on applied research and lifestyles and low-risk prostate cancer. So that's going to be on the same time, same station, 12 noon, Saturday, September 30th. Briefly, the program will feature Dr. June Chan and her research team at the University of California in San Francisco, and they will demonstrate research findings and pending research ties into diet, exercise, mental health, and avoiding known and suspected carcinogens in food, air, and water, and how some genetic mutations influence lifestyle factors and cancer progression, aggressiveness, and death. So look for that link as soon as I get off here. I will put that in the chat, and I encourage you to sign up today. One more very brief detail. We are very excited that Dr. Loeb will be joining us at 1 o'clock after the presentation for a live Q&A session. It's going to be a half an hour, folks, so we're going to try to squeeze everything that's possible in. Several people did submit questions in advance, which we do plan to address. We will try to weave in a few additional questions from the audience So please, if you do want to clarify something that you heard in the webinar, feel free to put it in the chat. And with that, I would like to pass this on briefly to Jeff McLennan, and then he will then introduce Howard Walensky, who basically made this all happen today. With that, Jeff, take it away.
Good morning, everybody. Welcome from sunny Northern California, where French bread is made and fine Chardonnays. I want to thank everybody for being here. Martin, thank you for the intro. I'm your fundraising guy. I'm going to ask those of you who feel appropriate that you give us $50 sometime today or tomorrow. We operate on money like everything else. We're all volunteers. We have a very high efficiency, low cost ratio. So thank you. Think of us. These programs are made available because we have production costs and other technical parts that we just have to put forward. Tune in again, as Martin was saying, on September 30th. We have Dr. June Chan from UCSF will be joining us. Have a great time today. Thank you.
Yeah, I guess I'll step in with 2 minutes to spare because we're on a tight schedule. I'm Howard Walensky. Welcome, everyone. Today's webinar spins out from one of our Active Surveillance 101 videos, which are designed to help newly diagnosed low-risk prostate cancer patients learn about active surveillance. I'm going to post a link to the other programs where we cover other topics. Today we'll first be streaming a video featuring Dr. Loeb on lifestyle, being questioned by Larry White, a prostate cancer patient, and his savvy spouse, Nancy. After the video, Dr. Loeb will join us at 1 p.m. Eastern for 30-minute Q&A. As Martin said, we'll include curated questions you sent in advance and new ones that you can submit now and for the next hour or so in the chat room. Special thanks to the Whites and to Alex and Peter Schultz from Prostate Cancer Research Institute. And with a minute to spare, Bill, we can go.
Hi, I'm Joe Gallo, member of the ASPI board and also a prostate cancer advocate with ANCAN. I'd like to welcome you to another segment of the continuing series Active Surveillance 101. AS 101 is presented by a coalition of active surveillance groups in the US and in Canada. And with that, I'd like to introduce today's host, Anthony Henry of the Walnut Foundation.
Hello, I'm Anthony Henry, President of the Walnut Foundation in Toronto. Today, the Active Surveillance Coalition is presenting another installment in its AS 101 series. The topic is diet, lifestyle, and low-risk prostate cancer. The AS Coalition is comprised of ASPI, the AS group within ANCAN, the Active Surveiller newsletter, Prostate Cancer Support Canada, the Walnut Foundation, and PCRI, which has helped in filming and editing these webinars. This webinar features Larry and Nancy White, a couple from New Mexico, who have been on the prostate cancer journey and are our model patient team. They're visiting Dr. Stacy Loeb, Professor, Department of Urology at NYU Grossman School of Medicine. Let's begin the webinar now.
All right, well, welcome. Hello, I'm Dr. Loeb. I'm a urologist and population scientist at NYU and the Manhattan VA, and it's very nice to meet you both.
Well, Dr. Loeb, it is very nice to meet you. We've been looking forward to this. I'm Larry, and this is my wife, Nancy.
Hi.
We appreciate the chance to learn from you more about what a prostate cancer patient should do regarding diet and lifestyle in order to keep cancer at bay, prostate cancer at bay. Do you mind if we record this session?
Absolutely.
Thank you, because we tend to have a hard time remembering everything that's talked about throughout this time. Nancy and I have been on this journey once we found out that I had prostate cancer. And we're trying to cope with this in the most positive way that we possibly can. I'm currently on active surveillance. I have a Gleason score of 3+3 and a PSA around 6. And we've had studies out the, so to speak. So we've been on this journey, and beyond a PSA periodically and an occasional MRI, we've been trying to figure out what is the best diet, exercise, a lifestyle that we can possibly do to optimize our care. And as a prostate cancer patient, we've at times feel helpless to go beyond our meeting with our doctor or the PSA test. And that helplessness is not a very good thing, I don't think. So we, of course, we've been looking at the internet, trying to figure out the best diet. We've been reading to try to figure out the best diet. And as you know, the internet is fairly confusing. But it seems like most of the medical literature talks about a plant-based whole food diet or Mediterranean diet. On YouTube, we might find a keto diet, carnivore diet, and Weight Watchers, of course, has been around forever, and Atkins has been an interesting one. It's confusing. We've also learned that active surveillance patients are probably going to die of something besides prostate cancer. And most likely cardiovascular disease, diabetes is another issue. But we're basically trying to find what is the optimum diet and lifestyle to lead a long and healthy life and keep cancer at bay. And so we're here with you to try to figure out, because we know you've done a great deal of research and practice, and can you help us figure this out? Can you help us move forward in a positive way?
Well, that's just fantastic. So Larry and Nancy, first of all, I want to congratulate you on this important mission that you're undertaking. I think it's so important for patients and their families to consider, not just surviving, but thriving with prostate cancer, as my colleague, Dr. Gio Espinosa, likes to say. And I do think that this is a very important opportunity for many patients with prostate cancer and families to turn around and really improve upon their lifestyle and maybe even end up healthier than before they were diagnosed with prostate cancer. So let's not think of this as the end. Let's think of this as a new beginning and a new opportunity to optimize health, because there's no question that how we treat our body and what we put in our body makes a difference. We spend a lot of time thinking about what's the best oil to put in our car and things like that. But how about fueling our own engine with the best fuel? And so I think it's great that you're interested in this. It is extremely important for prostate cancer and overall health. And also that you have some skepticism over all this information on the internet. That's certainly another area of interest. We have a grant studying online misinformation about prostate cancer. I know you mentioned YouTube, and we found that actually the majority of the top videos on YouTube about prostate cancer contain some kind of bias or misinformative content, and it's actually more widely viewed than the accurate content, which is pretty concerning. So it's good that you're, coming in and exhibiting some skepticism over all this stuff that's floating around out there. The bottom line, to answer your question, if there is a best diet, I think you're on the right track there, that, Mediterranean or really whole food plant-based diet approach is what I consider the best diet for prostate cancer. That is, avoiding animal products such as red meat, processed meat, and dairy, and focusing primarily on whole plant-based foods. And when we say whole foods plant-based, we're not talking about Whole Foods, the grocery store chain in North America that's very expensive. We're actually talking about whole foods from the earth, In fact, leading this type of diet has actually been shown in studies to be cheaper than the standard American diet. If you buy a big bag of beans or lentils, for example, that's a lot cheaper than buying meat in the grocery store. So, you know, for people who are on a fixed income or watching finances, this can actually not only be a way to improve health, but also to save money, both in terms of the food itself, as well as fewer expenditures on chronic medical conditions like diabetes. So I personally am a true believer in a whole foods, plant-based diet. This is due to our research and the preponderance of medical research on this topic. And I think it's important to preface, you know, that I'm coming to you as somebody who truly believes the evidence so much that I myself have converted for 3 years now to a whole foods plant-based diet, as has my whole family, including my parents. And my dad was somebody who ate pork rinds and all kinds of, you know, just horrible processed meat substances in the past, you know, and if he could do it, I really think anybody can do it. But, you know, equally important is also the rest of the lifestyle. And, you know, we can talk a little bit more about this later, but physical activity, also very important. Healthy sleep and stress reduction are also very important. So these are all the pillars of lifestyle medicine. And people often want to say, well, like, what's the most important thing to do? And, you know, it's not like, oh, you know, if I just have the perfect diet, I don't have to worry about physical activity, you know, like, no, you know, a sedentary lifestyle really isn't good for anybody. And sleep is just so fundamental and so important for physical health. And these things are so intertwined that you can't just break one out and like not worry about everything else. Because if your sleep is poor, then people tend to gain weight and eat worse food, and it's harder to do all of the physical activity. So it's all just so interrelated.
How difficult is it for patients to start a whole food plant-based diet and also stay on it for a long period of time?
And
You know,
get their whole family involved, you know,
Yeah.
their kids as well as spouse.
That's right. Yes. Well, you know, certainly the social support can really be very helpful. So I do think that if you, you know, have a family, and not everyone does, some people live alone and, you know, are eating by themselves primarily. But if you are around other people and eating with other people or physical activity with other people, that can be a really big help. And, you know, as with any kind of behavior change, I think at the very beginning, there's some upfront learning that we have to do. Many of us, myself included, were raised on the standard American diet. The acronym is SAD, Standard American Diet, SAD, because it is sad, because that's why our country is lots of obesity, lots of diabetes, lots of cancer. But we can change this. But there is some re-education that occurs. You know, a lot of people think dairy is calcium. People don't necessarily get a lot of education on other sources of calcium. And, you know, what's very interesting is some of the best foods for prostate cancer are cruciferous vegetables, things like kale, broccoli. Well, turns out they also happen to be great non-dairy sources of calcium. So just learning some of these things up front is a little bit of an education, and just changing out your kitchen, you know, learning about some new products. Before I went on this journey, I'd never heard of nutritional yeast.
Right.
I really, they need like an ad campaign for nutritional yeast, because it's such a great food. It's just so nutritious, and it really substitutes like Parmesan cheese. You can pour it on popcorn or vegetables or anything else for some extra flavor. So I think there's some upfront learning just in terms of finding some new products. But then once you're in a new behavior for usually like at least 21 days, it really can tend to stick. So I think it's important to just find a time to start learning, maybe even just introducing some new plant-based foods each week before you start subtracting anything, just to expand the repertoire. So you don't feel like I'm deprived. I don't know what to eat. I can't eat anything. What do I do? Maybe you just start with one new dish first. Maybe I'm going to have like a quinoa grain bowl, and that's going to be the first thing. Maybe I've never cooked quinoa. Turns out it's so easy. It's actually a really easy thing to make. It's a complete protein, this is a superfood, so just try eating quinoa and before you even stop any other foods. So I think thankfully there are a lot of great resources. One thing that really helped me, I have to give a lot of credit to Dr. Scott Egner, one of my wonderful colleagues in the field, also somebody who's, well known in the active surveillance community. He heard that I was undergoing this journey, so he sent me a box of Purple Carrot, which is like a meal delivery service with plant-based meals that he had been using for years. And they send you all the ingredients and the recipes, and then you cook it. Now they actually have some prepared meals. But, their website actually has all the recipes for free for their meals. And I learned a lot, so much. I mean, I'm really just so grateful to Dr. Egner. He's actually sent this to a lot of urologists. So many of the urologists that are in the active surveillance community are actually, doing plant-based meals through Purple Carrot themselves. But bottom line, there's a lot of free resources online. You don't have to belong to any kind of subscription service. For example, nutritionfacts.org is a really wonderful website led by Dr. Greger. He's a best-selling author of How Not to Die, which is a really fantastic book. There's an accompanying cookbook, the How Not to Die cookbook, but that website has a lot of recipes for free. Another nice resource is the Physicians Committee for Responsible Medicine, or PCRM. They have a ton of recipes that are created by nutritionists and physicians on their website, but they also do a lot of courses like plant-based jump starts. Many of them are free or just a nominal fee. And so, just partaking in some kind of educational program can be really helpful. And then there's other resources that I think can help get people off the ground. Happy Cow is an app and a website that works anywhere in the world to find plant-based food. So I thought, maybe this is going to be a real nightmare for me when I travel. I go to all these conferences all over the place, and, many of my patients have to travel for work or for pleasure and are worried. But I must say, I've used it in all sorts of places, Mexico, Sweden, you name it. And it locates right near where you are, anywhere, stores, restaurants that you can find plant-based food. So, I think it is possible, and I'm coming to you not as somebody who's going to go eat a bacon cheeseburger right after this recording. I'm living this myself, so I believe that it is possible and that many people really feel just so much better. I mean, my family is just thrilled with the effects, especially things like reducing cholesterol, which has always been a big problem for my parents, and, weight reduction.
Well, another thing that we've been reading about too is the impact of inflammation, both for cardiovascular disease as well as maybe prostate cancer. I mean, is this a diet that really helps with inflammation, or?
Yes, for sure. I mean, there's a huge overlap between like an anti-inflammatory diet and a whole foods plant-based diet. Some of the most inflammatory foods are these things like the meat and the dairy. So yes, I think it is all tied in together, and very important to get a lot of antioxidants in the diet and fiber. It's really interesting to me because people always seem so concerned about protein, but actually, like, most people get more protein than they need in America. So that is certainly a problem in some parts of the developing world where there is protein malnutrition, but that's certainly not the case in the US. Actually, the nutrient that we're not getting enough in the US diet is fiber. Most people don't eat enough, and that is really important, for the microbiome and for health. So what's another fun fact? So fiber is only found in plant foods. So you just can't get it from a steak or cheese. And cholesterol is only found in animal foods. So the composition of these foods and the kind of nutrient profile that you're putting in your body is just really different.
Well, if I'm not going to get protein from my steak or my chicken, where do I get my protein on this plant-based diet?
That's a great question. And, there's so many great options to get protein from plant-based sources. And like I said, many of them are actually cheaper, things like beans and lentils. Quinoa is another great option. I managed to get so I'll talk through like a typical day. Okay. Like what could you actually eat, for example, because I think it's nice to operationalize these things. So breakfast could look like, for example, overnight oats with chia. It's so easy to make. You literally take some oats, which alone or with some chia along with it, with some kind of plant-based milk. And it's interesting, nuts are also something that's good for the prostate. So you could go with a nut-based milk, for example, like almond milk, and you just literally stick it in the fridge overnight, and it sort of makes more of a like pudding or thicker consistency. And that can be, you can add things like flax or blueberries for extra nutrition. And so you're going to get some protein from some of these nuts or nut milks. Lunch could be something like, a hummus wrap with a whole grain wrap with vegetables. You can get, chickpeas is a nice source of protein. You could have a grain bowl with quinoa. That's a wonderful complete protein. Quinoa, even with beans in there. A lot of vegetables have protein. Oatmeal has protein. The things that we think of as protein are just things like a big steak, but there's protein in a lot of places. So, and then things like tempeh, seitan, tofu, these are all very high protein foods. So a dinner could be like sauteed seitan. Tofu is really easy to make in an air fryer. That makes it nice and crispy, and it cooks up very quickly there. So just cutting it and stick it in there. It's quick, it's simple. So that could be paired with a broccoli. Another real hack could be using textured vegetable protein. It's this shelf stable substance. You just like buy it on Amazon, huge bag, lasts a really long time. And if you want to have, your cooked tomato products for lycopene, which is very good for the prostate, just rehydrating some of this textured vegetable protein in the tomato sauce as part of a pasta dish or an Italian dish, this can add some extra protein that's cheap, and it has a texture kind of like a crumbled beef. So it can go in soups, it can go in tacos, and it is sort of flavorless. It really just takes on the flavor of whatever you cook it in. So that would be another nice thing. For the prostate, I think, the focus really wants to be on, trying to get ideally at least 5 servings a week of cooked tomatoes with lycopene. You want to have cruciferous vegetables every single day if possible. This would be things, there's a lot of them, luckily, broccoli, kale, bok choy, whatever it is that you like or that goes well with the cuisine that you eat.
Excellent. Well, I'm sure you didn't come by becoming a plant-based whole food person without research. I know you do research. I mean, did your research, is that supportive of your diet, of your practice, and everything?
For sure. Yes. So one of the big studies that we published on this was using data from the Health Professionals Follow-Up Study. So this was a collaboration with some very famous nutritional epidemiologists at Harvard University and University of California, San Francisco. And we looked at thousands of men in this study and what they ate over time and how that affected their risk of prostate cancer. And the men who consumed more plant-based food had a lower risk of developing fatal prostate cancer over time. So, that was really exciting. And, I've done a lot of research. I've been doing research for 2 decades. And, no matter what we did with the data, adjust the model for the amount of exercise, adjust for their body mass index. No matter how we spun the data, it was always the same association. It's a robust finding, so you could say maybe the people who eat more plant-based also do more physical activity. So maybe it was the physical activity. No, adjusting for that didn't change the results. So I think it is very robust. We also did a systematic review of the literature of people on actual plant-based diets. such as vegans, vegetarians. And there have been 5 interventional trials of these diets in patients with prostate cancer. The 2 main settings that it's been studied are active surveillance, which is relevant to this particular group. There's a randomized trial of patients on active surveillance who did a vegan diet with moderate physical activity and stress reduction. And those patients had a lower risk of progression of their cancer compared to people who did not do the lifestyle intervention. So, we have level 1 evidence, randomized data supporting this approach for patients on active surveillance specifically. But there have also been studies of patients who have biochemical recurrence after treatment for prostate cancer. And it was also found to be helpful in that context as well. So bottom line, I think we really do have evidence across the spectrum of disease in terms of both prevention of prostate cancer and most importantly of aggressive prostate cancer, as well as benefits for patients who already have prostate cancer to slow the progression of disease.
And does it also have a similar benefit for cardiovascular health?
Yeah, absolutely. So the lead author of the randomized trial for prostate cancer is Dr. Dean Ornish. It was done at the University of California, San Francisco. And he also published in, I believe it was JAMA a few years before that on a randomized trial of a very similar intervention, a low-fat vegan diet, physical activity, and stress reduction in people who had coronary artery disease. And what they found in that trial is that there was actually a regression of the stenosis of the coronary arteries in the people who followed this diet and fewer cardiovascular events. So I think your question is so important because we do need to think, especially in the setting of active surveillance, where patients are more likely to die from other causes than from prostate cancer, about the whole patient. And so having the same dietary recommendation that's good for cardiovascular disease and good for prostate cancer is great news. It's not, it's wonderful when the stars align and everything actually is coming together. And you know what, I'll mention one more thing. We just presented brand new data at the ASCO meeting. It's the main cancer meeting in the country, and it was just held in June. We presented some new data of patients with prostate cancer in the health professionals follow-up study, and we showed that consuming more plant-based food was also associated with better quality of life, because in terms of better erections, better bowel health, et cetera. So aside from the, oncologic aspects in terms of, progression of the cancer, it's also important to consider quality of life. And, there's certainly been a lot of data suggesting that eating more plant-based food is helpful in terms of erections in the general population. And it appears to the same thing is true for men who have prostate cancer.
I'm sold.
So if I'm a big bodybuilder, weightlifter, and think I need to eat a bunch of steak and eggs and bacon, I might be doing myself a disservice in terms of my sexual life.
That's absolutely true. There's definitely some kind of, meat as masculinity myth. But, The Game Changers is a really great documentary for people who have some skepticism about that. Some of the strongest people in the world, the person who set the Guinness Book of Records for lifting a car or some, crazy feats of strength is actually on a plant-based diet, as are many of the elite athletes out there, Novak Djokovic, Lewis Hamilton, just to name a few. So bottom line, if it's possible for these super athletes to get their, significant protein requirement from this diet, then I think it's certainly possible for, myself and most of the, normal fitness people of the world to do that.
Do you find any objective data on your own in terms of PSA decreasing or maybe nodules or tumors in the prostate by MRI? Do you see a decrease in PSA or even a decrease in what we might find on an MRI?
Yes, so that's a really good question. And that is something that they looked at in Dean Ornish's randomized trial of the patients on active surveillance. So they published in the Journal of Urology that in the group who did the intervention with the vegan diet and physical activity, that their PSA actually went down in the first year by an average of 4% from the baseline, whereas the control group, the PSA actually went up by an average of 6% from the baseline. So I do think that with an intensive lifestyle intervention, it is possible to reduce PSA. Similarly, in men without prostate cancer, there was a study published about a year or two ago showing lower PSA levels in people who eat more plant-based food. Your question about MRI, that is not something that has ever been studied that I'm aware of in terms of whether you could see a regression of a tumor on MRI. However, I do think that it's theoretically possible based on data from the Ornish study, because they did cell cultures of prostate cancer in a lab, and they took actually the serum from people in the trial who did the lifestyle intervention, and it did cause a greater regression of these tumors in the cell cultures. So is it theoretically possible by extension then that we could see a regression in an MRI, just like they saw a regression of those coronary artery plaques? Yes, I think it's possible, but there isn't any data on that at this point. You know, I don't think diet and lifestyle is, you know, a magic bullet. You know, I don't think it's going to cure somebody of their cancer, or that it should be done in isolation. You know, if somebody's cancer is progressing, standard therapy is still very important. So I'm not a proponent of alternative medicine, but I do believe that complementary approaches are important, and that alongside any form of management, that all of these, whether it's the nutrition, lifestyle, sleep, are all critical, both to enhance the you know, benefits in terms of cancer and to preserve quality of life.
Okay, well, one of the diets that, as I look at the literature, really looks at the Mediterranean diet. And although a caveat seems to be that, well, we don't think our patients could really do the plant-based diet, and maybe it would be easier for them to follow the Mediterranean diet, which again is pretty much is certainly plant-based, but it adds meat protein as well as copious quantities of olive oil. You know? So you really believe and practice the plant-based whole food rather than the Mediterranean diet, but
I do. I mean, one reason is, interestingly, in the same population that we studied the quality of life in men with prostate cancer with more plant-based food, they actually didn't find any difference in the erections or the urinary function with a Mediterranean diet after diagnosis. So I think there probably is, to some extent, a dose effect here. You know, certainly I think Mediterranean diet is along the right pathway, and there have been studies showing Mediterranean diet is associated with less erectile dysfunction in men without prostate cancer. Similarly, there are studies showing plant-based diet is associated with less erectile dysfunction in men without prostate cancer. Listen, I think anything that anyone can do, I try to meet patients where they're at, and there are some people where they just truly feel that they can't give up all of the animal protein in their diet. And I think fish would definitely far and away be the top choice in terms of prostate health if you're going to consume an animal protein. So if you consider a Mediterranean diet to be basically like a vegan diet plus fish, I think that is fine in terms of prostate health. But it's still a good idea to avoid any of the red and processed meat, and to avoid dairy. So having the Mediterranean style where things are cooked in olive oil instead of a solid fat like a butter, this is a much better approach and really aligned. So I think this is all along the same spectrum. Mediterranean to whole food plant-based is pretty similar. And if you can fall somewhere in there and, manage to maintain it with your lifestyle, I think that's fantastic.
I've read that processed meat is carcinogenic. Is that right?
Yes, it is. So the World Health Organization puts out a list of carcinogens, or things that cause cancer, and actually processed meat is group 1 carcinogen. This means that there is definite evidence that it causes cancer in humans. This is the same category as things like smoking, asbestos. So why more people are not aware of this, like you, Nancy, I'm really not sure. I think there should be a label on hot dogs and deli meats and things like that, because, you know, that would scare the crap out of me, you know,
Yeah.
and I didn't know that it was in that group until a couple of years ago myself, and I'm a physician. That being said, most physicians don't get a lot of education in nutrition and medical school. So, you know,
Sadly.
so there you have it. Now, red meat is a group 2 carcinogen. So this is, you know, things like beef, pork, those kinds of foods that are not processed. And so those are probably carcinogenic, because in studies for especially colorectal cancer, but also some studies of prostate and pancreatic cancer associated with a higher risk. And I just don't think there's really a lot of need or benefit to eating any of those foods. So I really would recommend just staying away from that whole category. And like I said, if there was to be a single animal food in the diet for prostate health in particular and cardiovascular health, I think the best choice would be fish.
Okay. Well, a lot of people I know anyway, and maybe myself included, have thought chicken was really healthy though. So everybody's really throwing chicken on the barbecue,
A
and,
lot of people.
you know, instead of maybe a big steak or something like that. Is chicken in the same category as the pork?
I think, you know, it's certainly not as harmful as steak, but I think fish would be a better choice than chicken. Chicken has a lot of other issues with it. It's high in sodium content. It's also very interesting new data that is linking especially chicken and to some extent pork with resistant infections. And so especially for an active surveillance population, you know, I know we talk a lot about prostate biopsy infections and things like that. So there's a huge new study that came out suggesting that a lot of resistant infections of the urinary tract are also actually due to bacteria that comes from commercial meat samples, particularly chicken is a reservoir, followed by pork. So I think there's some other concerns with chicken. So I don't think it's specifically as harmful for cancer as its red meat cousins. However, I don't think it's overall the best nutritional choice for the diet.
My goodness, you've really provided us with so much excellent information, and even places to go to get more information.
Right.
You know, I think.
Yeah.
And, you know, to get on the exercise path and take care of our gut, I guess, with more fiber and everything.
And,
Yes.
and on exercise and sleep, how much exercise is recommended to get the benefit?
That's a great question. So the physical activity guidelines recommend that people should do at least 150 minutes a week of moderate intensity physical activity. So that's aerobic activity, you know, so any way that you like to do it. And if you're doing more vigorous activity, at least 75 minutes a week of vigorous physical activity. And there are some great studies of physical activity in the active surveillance population. Just in the past couple of years, the ERASE trial was published, and this was a study of high intensity interval training in active surveillance 3 times a week. And they found some nice benefits in that study, both in terms of PSA as well as just overall cardiopulmonary fitness. But, you know, I think integrating some aerobic physical activity, whether it's brisk walking, and it is better for prostate cancer. There are studies showing brisk walking is better than slow walking. So that could be an option, or however you like to get cycling, swimming. There's so many great ways to get aerobic activity. Along with that, it's also recommended to at least twice a week do some kind of resistance training. This is really important, you know, for bone health in particular, as well as at least 2 days a week doing some flexibility exercises, things like stretching or yoga. And why I like that too is that it's also can be a really nice way to do some mindfulness practice. dealing with a cancer diagnosis, active surveillance, these can be very stressful for some patients and their families. And so finding ways to reduce stress. So something like yoga can be a very nice way both to, stretch the body, but also to have a mindfulness practice and try to reduce stress. And there's just tons of great yoga videos out there. It's something you could easily do from home. Even just 10 minutes a day of something like that can really make a big difference.
And sleep, I've just been going through a sleep study myself. And just because you want to sleep doesn't mean you can sleep. But sleep is important as well. I take it for this whole piece about being healthy and everything.
For sure. So it's very interesting. There was a systematic review that really did find numerous studies that link disturbances in sleep or circadian rhythms with a higher risk of prostate cancer.
Really?
And our group and others have also done studies of patients with prostate cancer and their caregivers and family members showing very high rates of sleep disturbances. In fact, the rate of sleep medication use is even higher in the partners of patients with prostate cancer. So, this is something that we all have to be worried about here, because if you don't get enough sleep, it increases the risk of cardiovascular disease. It increases the risk of mental health issues, as well as, obviously things like car accidents and healthcare utilization. So really across the spectrum, sleep is just so fundamental to our physical and mental health. And these problems are so prevalent in the prostate cancer population. And the way forward is not just to take sleeping pills. It is important to figure out what is causing the disturbance. If it's something like nighttime urination, then talking to a urologist about ways to reduce nighttime urination is important. If it's anxiety, something like cognitive behavioral therapy or mindfulness meditation can help to improve sleep. And then, everyone should just try their best to have good sleep hygiene practices. It's best to wake up around the same time every day and go to bed around the same time every day. You want to have ample light exposure in the morning, but not right before bed. Especially, not using electronics right before bed, not eating a big meal right before bed. The exercise piece is very important and it's good for sleep, but it's better to do earlier in the day. You don't want to have a lot of smoking or alcohol before bed. And then just thinking about the bedroom environment, the bed should be for sleep or sex, not doing work or other activities in bed, so that it is really just a relaxing space and trying to make the room as comfortable as possible. If it's too cold or too hot, that's not going to be conducive to sleep. So I think probably every one of us could identify some, bad behaviors we're doing, whether it's, checking work email right before bed and things like that. And so if we're not happy with our sleep, there's probably also some behavioral things that everyone could try that could make a big difference.
Right. Well, one of the reasons I even did the sleep study was because I had a mild stroke. And my doctor said, you're going to get a sleep study. And my wife has told me for many years I snore and everything.
Oh.
So I went to get the sleep study. And not only did the sleep study person tell me that it can impact stroke as well, but also even nighttime urination.
Yes.
So I've had the sleep study and I'm waiting on my CPAP machine, which I'm really looking forward to.
Yes.
But I do want to be healthy, but that was one of the things I didn't know either about the stroke, cardiovascular, so many things related to sleep. So.
Yeah, so there's a ton of research recently on the links between sleep apnea, what you're describing, people who snore, with quite numerous different health conditions, and even in the urology space, close to home for me and for anyone, living with prostate cancer. First of all, obstructive sleep apnea has been linked with potential progression of cancer because hypoxia in the environment of the tumor due to not getting enough oxygen has been related to cancer progression. Also, it is linked to nighttime urination. So when you have sleep apnea, the hormones that are released from that actually cause you to pee more at night. So that is a direct link. But then more recently, there's been a lot of studies linking sleep apnea with a greater risk of erectile dysfunction as well. And the mechanism there is thought to be this same hypoxia mechanism, where if the corporal bodies or the erectile bodies in the penis are not getting enough oxygen, that may be an underlying mechanism that relates to erectile dysfunction. Dr. Mulhall at Memorial Sloan Kettering, his group has done some studies showing lower rates of recovery of erectile function after radical prostatectomy in patients who have sleep apnea. So I definitely think, if anyone who's listening to this, snores and hasn't had a sleep study, I would get in there and see a sleep doctor, because not only is it related to, cardiovascular health, but also to some of these urinary and sexual issues that we think about in terms of prostate cancer. So I think it's wonderful that you got checked out, and, getting, as much as, CPAP is going to be a big adjustment, getting that full oxygen overnight is going to help your whole body, including, the urinary and sexual tracts.
Right.
My word, coming to you like this, we've learned so much today. And the thing about it, I don't know that many doctors really have your level of information and research on these issues. Even nutritionists that I kind of follow or listen to are really not on this page. And certainly doctors, my own internal medicine doctor, in fact, may struggle with this kind of information. So how do regular folks find people like you to really move in this direction that we're talking about here?
Yes, well, there's the American College of Lifestyle Medicine is a board certification. So I'm actually working on that myself, because I think it would be very neat to be double boarded in urology and in lifestyle medicine, and provide some of this unique kind of expertise that I do think is very important but lacking in the field. But they do have search tools to find lifestyle medicine specialists. And, I think this is just something that needs systemic change, to be honest. There needs to be greater emphasis on nutrition in the medical school curriculum. I do think there is some positive shift in that direction. So hopefully, the next generation of patients with prostate cancer will fare a bit better. Here in New York City, Mayor Eric Adams has had a lifestyle medicine initiative, because he himself reversed his diabetes with a whole food plant-based diet. So he wrote a book about his journey from going blind from diabetes to completely reversing diabetes with his whole foods plant-based diet. It's called Healthy at Last. But I think related to this personal experience and passion for the topic, he's actually caused all of the New York City public hospitals have a lifestyle medicine program for people to learn whole food plant-based nutrition to help with diabetes management and cardiovascular health. And additionally, he has budgeted so that any healthcare professional in the state of New York can take a lifestyle medicine curriculum for CME credit, or the medical education credit, for free. So that is being promoted and advertised. And so people can take this course to learn more about this. But from the bottom up, for instance, I recently gave a lecture for the new culinary medicine elective at the New York University School of Medicine. And the medical students can take this elective where they learn more about plant-based nutrition and actually go into a kitchen, a commercial kitchen, where they learn how to cook some of these foods such that they could be able to better inform patients how to do this. Wow. So that certainly was not available when I went to medical school. I wish I could take this class. It just sounds amazing. So more medical schools are starting to offer things like culinary medicine. So like I said, I really do hope that the next generation of prostate cancer survivors will have a very different experience in terms of the amount of emphasis that this very important area receives.
Right.
Wow.
Do you have anything at all to say about alcohol consumption and cancer?
The data are pretty mixed on alcohol in terms of prostate cancer. I would say my general take-home message from the research is that consuming, a moderate amount of alcohol, like 1 drink per day, particularly of wine, is not harmful for prostate cancer specifically. Now, there have been some studies that consuming a higher amount of alcohol, like more than 3 drinks a day, for example, could be harmful in terms of prostate cancer. So we generally tell patients just to, moderate intake, particularly red wine, which even had some benefit in one study of prostate cancer, is okay. But, I would really try to stick to, less than 2 drinks per day for men, and 1 drink or less per day for women.
Well,
That's my last question.
is there anything else you can add? I think you've answered our questions and really provided so much great information for us. I think we have a pretty good path now to, and of course, we're going to head up to New York and see you, I think, occasionally.
Well, thank you. I'm glad it was helpful. And, I hope that others who watch this conversation, first of all, have, the great attitude and interest that you have in, using this as a very positive opportunity to improve your overall health and well-being.
Well, I think that it's so important, because as we find out we have prostate cancer, when I first started this process, I was just ready to have surgery, get it removed and move forward. And my whole attitude has changed. And I know I've had much more hope talking to the people in this forum. And today you've provided, I think, even more avenues for hope as well. So I think that's critically important. So again, thank you very much.
Well, great meeting you both, and thank you so much.
Thank you. Thank you so much
Thank
for all the
you.
information. We appreciate your time and interest. Thank you.
I'd like to thank Nancy, Larry, Dr. Loeb, and all involved in this production. The hope always is that this leads to improved health outcomes for patients. Thanks again for all your contribution to this effort.
We're back in real time now, and Dr. Loeb, I think that's really you, right? Can you get some sound out? Thanks so much for doing the Active Surveillance 101 video. And just so the audience knows, we have a hard stop of 1:30 p.m. Eastern. And so without much more ado, I'm going to ask a couple of opening questions, and then I'll switch over. These are questions we got in advance, and then we'll switch over to Martin Gewirtz, who will scoop some questions up from the live audience. But first of all, Dr. Loeb, is there, and I think you did sort of address this, but is there any scientific evidence or data to suggest that going on a whole food, plant-based diet or a vegan diet will cure prostate cancer or any other cancer, as well as prevent it?
Right. So great question. Certainly a ton of great evidence, both observational studies as well as prospective clinical trials suggesting benefits in terms of reducing risk and reducing progression. But there's no magic bullet here. There's no specific diet or anything that, can just cure prostate cancer on its own. And so I still recommend, standard therapies. This is an adjunctive measure, and it's an extremely important one to make the overall course of disease better, and in terms of both oncologic outcomes and quality of life, and also for those who don't have cancer to reduce the risk of cancer. But nothing is a magic bullet.
Gotcha. Second of all, why did you go on a plant-based diet? Obviously, you're not dealing with prostate cancer, but what made you decide to do it, and what value have you gotten out of it?
Yeah, it's been a great journey. Initially, I was lecturing in Australia during the wildfires there, and I learned more about how meat is fueling climate change and just how plant-based diets are much more environmentally sustainable. And that got me reading a lot more about plant-based diets, and I saw all of the health benefits, including, what I mentioned earlier in the webinar, regression of coronary artery plaques and reduction in progression of prostate cancer. And, just like probably many of your urologists, I just never learned this stuff in medical school or in my training at all. And so it was a real eye opener. And I think a lot of doctors, sadly, don't know a lot about nutrition, but I was just amazed by the health benefits that I read. So my whole family switched, and we're doing great. I mean, my mom had really high cholesterol. I mean, just terrible. And now it's the lowest of her entire adult life, and she's thrilled. So, I don't have obviously prostate cancer or some of these issues, but hopefully this will prevent me from getting, breast cancer or for following my mom with high cholesterol in the future, alongside, the other pillars of lifestyle medicine. So just this morning, I just actually got back from doing a 10-mile race in Brooklyn. So, I'm also very, a big physical activity enthusiast. So I think, and getting good sleep and, finding ways to, just reduce anxiety and stress. I mean, having a cancer diagnosis is stressful. Being a urologist is stressful. We all have stress from different things in our lives. And, for me, actually hitting the pavement is a great way to simultaneously promote health and reduce stress.
Thanks, Martin. Why don't you pitch out a couple of questions?
Sure. First of all, thank you, Dr. Loeb. All of us on the board at ASPI are so grateful to you for, giving us your time. We know that you have an incredibly busy schedule. So again, thank you. So there have been some follow-up questions regarding fish. I myself know that one of the comments around fish are that the possibilities of chemical interference, especially with salmon off of the coast of Alaska being contaminated by the Fukushima incident, tumors, and just polluted waters. So if you can address that, and then I'll make this a two-parter. Some more, just some follow-ups on alcohol, if you have any comments about that, and if a whole food plant-based diet could lower PSA. Okay, great. And thanks to everybody for submitting these great questions, both beforehand and in the chat. These are all really excellent. So, fish, I mean, I think, as I mentioned in the webinar, is definitely the best choice of any animal product. So if you, don't want to do a full-on whole foods plant-based, I think vegan plus fish would be a very reasonable alternative. In fact, my parents actually, I'd say, are like 99% whole food plant-based, but they, occasionally go out to dinner with other couples and they'll have a piece of fish here and there. So I think, that kind of thing is absolutely fine. That being said, I think what you mentioned, Martin, is a bit concerning. Where do you get your fish from nowadays? Because some of the wild fish are having these issues like pollution and also microplastics. There have been some really just creepy studies showing tons of microplastics in the fish because there's so much plastic pollution in the ocean. So the thought that you're actually eating plastic is, so God only knows what we're going to find, 10, 15 years from now, about people who were eating a lot of fish. So I don't know if the fish today is as decent as the fish before. On the flip side, if you get your fish from farmed fish,
I mean, that's a whole nother set of problems. That's the same problem as factory farmed animals. I mean, if you've ever seen footage of a fish farm, I don't think you'd ever want to eat the fish again. You know, they're crowded in these murky waters and they have to get tons of antibiotics to stay healthy, just like the land animals do. So that's a very unhealthy environment too. So, I mean, the wild fish would theoretically be better, but if the water that they're in has all this pollution or plastics, so I don't know. I don't know what to say there, but you know, at least in historical studies, fish was a better choice in terms of cardiovascular health and prostate health. For me, you know, I just do the full whole food plant-based, and I've been, you know, very happy with that. And you know, but an occasional piece of fish, I think, is absolutely fine. And then what was the next question you asked?
Martin, you're off.
What your feeling is about a whole food plant-based diet lowering PSA?
Lowering PSA. Yes. So yes, I mean, it did seem in that prospective trial that a whole food plant-based diet could actually lower PSA. Now, like we said, like none of these dietary or exercise things are a cure for cancer, but there have been quite a few studies suggesting that it, you know, has a favorable impact on PSA kinetics. So yes, I think that is actually possible.
Thank you. Over to you, Howard.
Okay, feel like we're on the anchor desk here. All right. There's plant-based diets and there's plant-based diet. Are they all created equal? Is there a difference between vegans and vegetarians and other groups? And is there any difference in their impact on preventing or slowing prostate cancer?
Yeah, great question. And yes, I mean, there's definitely a spectrum of plant-based diet. So there's, you know, the Mediterranean diet, which is basically sort of like a plant forward, but includes things like fish, but everything is based on olive oil cooking, not with butter. And then there's vegetarian, and they will not consume any, you know, land or aquatic animals, but they do eat things like dairy. And then there's vegan, which has no animal products at all, so no dairy, no eggs, no dairy, and no land or aquatic animals. Now, there haven't been a lot of like head-to-head studies, like this group of people did vegetarian and this did the full vegan. But in studies of vegans, of which there are not very many, but all of those studies have had favorable results, and not all of the ones with vegetarian. My hypothesis for this is that it's because of the dairy, because we know that dairy is associated with prostate cancer risk and also with progression. And so, you know, excluding the dairy from the diet, it is a big difference. So yes, I don't think that they're all created equal per se, but certainly adding more vegetables and plant-based foods to any program and reducing or eliminating meat products is a great step forward.
Okay, there seems to be interest in different foods. And what's your take on pomegranates, milled flax seeds, and mushrooms as far as inhibiting prostate cancer?
Yep. So these are great questions. I think let me just start by, you know, saying again, you know, that there's no one food or diet that's going to, you know, cure cancer and that kind of thing. But all of these are things where there is some supportive experimental evidence, at least. So pomegranate, there's been experimental studies showing, you know, anti-proliferative effects, although the clinical studies of it have been a bit mixed. That being said, many of the clinical studies are not using like eating a whole pomegranate. They're using extracts where it's only a part of what you would receive if you were to eat the whole pomegranate. So it's hard to say. I mean, bottom line, like I definitely think pomegranate is a healthy food and worth, you know, incorporating into the diet because it's definitely not going to hurt anything. So I would put it in the like might help, can't hurt, but overall healthy category. Flax seeds are really, a very nutritious thing to introduce in your diet for many reasons, including potentially prostate cancer. I think you mentioned mill. That was a good point from whoever submitted this question, because definitely it is more bioavailable when you use these forms of flaxseed as opposed to the whole seed, which can sometimes pass through the body undigested. So I definitely would recommend that. I like to put flax into my breakfast cereals or smoothies. So I actually myself eat flax every day just because it has a very favorable nutrient profile for a lot of different diseases. And there's definitely, again, some experimental evidence suggesting that may be helpful in terms of prostate. Mushrooms, that one is a little bit mixed. There was a big study out of Harvard. It was like a combination study of the nurses' health study and the health professionals' follow-up study, and they looked at mushroom consumption. And they did not find any significant relationship between, higher levels of mushroom consumption with total cancer risk or with the risk of advanced prostate cancer, specifically in the male participants from the health professionals follow-up study. But, again, there have been some laboratory studies with mushroom extracts suggesting potential benefit, and they're just a healthy food in general. So I think if you like mushrooms, it's, in the won't hurt and might help category. I like mushrooms, so I eat them. I think all those three foods are great.
Yeah, Martin.
Great. I just want to interject for everyone listening that all of your questions and issues that you're raising in the chat are absolutely incredible. And we just, we have these time constraints. So I do want to assure you that because this subject is close to my heart, my board knows that, I am going to be copying everything, and I will be sifting through, many that were not, perhaps couldn't be addressed today because of time. And so I'll be, we'll be sure to address them, and I will I'll publish that in some way, shape, or form. Dr. Loeb, this is a three-parter, quick one. Just some confirmation about the topping that you suggested for the popcorn, and some questions coming in about, just to reiterate your feelings about alcohol. I know you talked about it with the whites briefly. And then a really good one, your opinion on the plant-based meats that are coming out now, such as Beyond Burgers or veggie dogs as a source of protein, because they're highly processed. So how do you feel? Do you feel like they have the same dangers as red meat?
Okay, yes, really great questions. And so the topper that I discussed was nutritional yeast. If you have not tried nutritional yeast, I recommend that every one of you on here, get some and try it out. I think it's a great replacement for anything that you would use Parmesan cheese, so you can use it to top pasta or anything else. I never really ate pasta previously because I don't eat a lot of refined carbohydrates, but Explore Cuisine has very nice pastas that are all made from beans. So I like their edamame mung bean linguine, and I like their black bean spaghetti. And I like to top those with cooked tomatoes and nutritional yeast. And it's a very prostate friendly dish because you've got your lycopene. And I think, a lot of people really enjoy the taste of nutritional yeast, and it's a great way to just get rid of things where you would have used cheese as a topper. The second question, which you had mentioned earlier, was about the alcohol. And yes, I did see a few comments about that, and it's okay to have a drink when you go out to dinner. at least for prostate cancer, the studies have really been mixed on that. So I don't recommend going crazy because there are studies suggesting that, large amounts of alcohol can be harmful. But just having a drink with dinner, that kind of thing, that's totally fine, particularly if it's red wine. The last question that you had brought up is a really interesting one about the plant meat substitutes. This is not part of a whole foods plant-based diet because it's not a whole food, it's a highly processed food. So I wouldn't call it a health food by any stretch. However, I still think it has advantages over what it's replacing. So if you are somebody that's used to eating a lot of meat and would have a hard time completely giving it up, many of them are absolutely amazing in terms of the taste profile or the texture. The Beyond and Impossible field roast Italian sausage is like pretty much a dead ringer. I thought it was absolutely amazing. So I definitely think that they have done a very good job with food development. And recently I've even seen a few fish substitutes. There's a plant-based lox that was almost indistinguishable. But these are all processed and some of them have a lot of sodium, and at least the Beyond Burger and Impossible Burger also have a lot of fat. So they're definitely not healthy, but I think they're a very helpful transition food for people who are trying to get away from meat. And they are also widely available. So this is not something that I eat on a regular basis, but if I'm traveling somewhere, they're even found in fast food restaurants these days. So at least it's some protein. But yes, not a great health food, but better than the alternative because it doesn't have any cholesterol. It doesn't have any known carcinogenic potential. And so it's a fatty, salty food that's not that healthy, but is unlikely to, make cancer worse. And it doesn't have cholesterol. So there was a study that was looking at these meats in terms of like cardiac markers, and they were lower than if you were to eat the meat that they're substituting for. So, I think it's definitely like a step forward, but it's not the same as eating, beans, legumes, and these kinds of things for your protein.
Okay, I guess I'll take the next round. Audience member who sent a question in advance asked about how animal protein increases levels of IGF-1, and that IGF-1 can promote prostate cancer. Plant-based diet seems to be a good way to avoid this. If IGF-1 levels are a concern for cancer, should people get their IGF-1 levels checked?
I love this question. This is such a good question. And definitely the whole IGF-1 pathway is, indeed involved in prostate cancer. And that is definitely one of the pathways by which meat is, carcinogenic. That being said, a serum level of IGF-1 at one point in time is not all that helpful. It's just not quite that simple. In fact, in some studies, particularly in younger men, serum IGF levels did predict prostate cancer risk, but more predictive of risk and prognosis are the tissue, what's happening with the tissue pathway, which is something that would have to be assessed, in a lab with a tissue sample, and it's not very simple to do. So I think, unfortunately, no is the short answer. I wouldn't recommend getting an IGF test. It's also, it's not a standardized test from lab to lab. So I don't think that having that number would be particularly actionable.
Then, okay, one of the big concerns about people going on one of these vegan or vegetarian diets is, can they get enough protein that way?
Right. So great question. This comes up a lot. And yes, for sure. I mean, like I mentioned during the webinar, a lot of professional athletes are on this diet and, have higher protein needs than most other people. I just did a 10-mile run and came home and had some tofu with broccoli and Brussels sprouts. So some nice cruciferous vegetables and lots of protein. There are so many. Protein is not equal to meat. It's not like you have to get protein from animal stuff. There are so many great options. I really love quinoa. You can throw all kinds of things in it. I think, beans and lentils are very nice. I really like foods with black beans. Yeah, so yes, you can definitely get enough protein. Plant-based milk substitutes, those are also very nice options. Just find one that you like. Some people like, like pea protein milk. Those tend to be very high in protein. Like Ripple is one of the brands of milk that's based on pea protein, and it's very high. So yeah, and even those pastas that I mentioned, the Explorer Cuisine, I just saw something pop up in the chat about that. Those Explorer Cuisine pastas that are edamame and mung bean or black bean pastas have 25 grams of protein per serving. So, this is a high amount of protein that is found even in the bean pasta. So bottom line, like there's many ways to get protein in it. It's not something that I'm concerned about at all. And I think, once you go through the learning process and find some of these foods that you enjoy, but there is just some upfront education involved in that and making a plan. So being, a dietitian or joining a Jumpstart program. Actually, Plant Power Metro New York, who has a really nice group here. You don't have to be from New York. They're having a Jumpstart, I want to say starting in October, with nutritionists to help people get on one of these programs. So I can definitely share the link with you guys in case you want to try that, because getting some help up front to help with meal planning is a great way to start to make sure that you're getting all these nutrients.
Well, Martin, I think we're getting close to the witching hour. So I think if you can ask a couple of.
Yeah, I have a couple. I have just a couple final ones. So Eric Youngdale would like to ask about your feelings about modified citrus pectin. I know that that's a it's a specialized question, but he asked me especially to ask you. And as well, how paranoid do people need to be or afraid about diet excursions away from the diet? Can any deviation, for example, eating out and having some, quote unquote, bad food immediately stimulate prostate cancer progression? And then lastly, and I'm not sure, I've been multitasking here, I'm not sure if you addressed this, but we're getting a lot of questions about sources for B12 on a whole food plant-based diet. Thank you, Doctor.
Okay, yes. So great questions. And we did get some questions that I had seen in advance about B12. In fact, one was discussing the relationship between B12 with prostate cancer risk, because there actually is a meta-analysis suggesting that people with high B12 levels had a higher risk of prostate cancer. That being said, it is important to get a sufficient amount of B12, and that is the only nutrient that you can't get through the plant-based diet that definitely needs to be supplemented. So I take a B12 supplement. And actually many people in the general population who are not on plant-based diets are deficient in B12, particularly people over 50. There's an increase. Other people who need to worry about B12 are anybody who takes antacids or proton pump inhibitors, because in order to digest B12 from the diet from things like meat, you need the stomach acid. So anyone who's taking those should be supplementing B12, because the supplement doesn't need the stomach acid and is actually easier for the body to absorb. So B12 supplement is an important part of the plant-based diet just to avoid deficiency, which can be associated with neurological and other side effects. So you want to get it at a normal level, but you don't want to, you know, astronomical B12 anyway. Oh, you asked about, deviations from the diet. Yes. So listen, like, we're all human, and, you know, if it's Thanksgiving and you want to have the turkey with your family for the special holiday, and that's very important to you, like, we all have to enjoy our life. And I don't think that a single day is going to make a difference. And in fact, in the study that we published last year from the Health Professionals Follow-Up Study, it really was like a dose response. Like, the more and more plant-based you were, the better. But people were still seeing benefits even if they weren't 100%. So this does not have to be so black and white. I think any efforts you can make in that direction, and if occasionally, you know, for special occasions, but I think make it special. You know, if you are going to deviate, you know, I think it's better to do it as a very special treat, as long as that activity won't cause you to fall off the bandwagon. You know, I think some people are different than others. For some people, you know, that's going to improve quality of life. For other people, you know, jumping off the bandwagon could kind of initiate a series of events to, like, go off the diet completely. So I think each of us, you know, I just try to meet people where they're at, and we all have to figure out what's going to work best for our life. And that was why I said earlier in the webinar, if you're not doing plant-based diet at this time and you want to get started, instead of feeling deprived, like, I can't eat any of these things that I liked, this is like depressing, start by adding first. So you're expanding the food repertoire. Maybe you've never made tofu. You know, tofu in an air fryer is like a nice crispy little, you know, nice, good protein. And soy is actually really healthy for the prostate. There is so much misinformation circulating about that, but you want to be eating that food. So if you haven't tried it, like, try a stir fry with tofu next time, or try soy milk or any of the plant milks from the grocery. And some people like one better or another, like, they're all fine, all the plant milks in terms of prostate. So, you know, if you prefer soy or you prefer almond, I happen to really like macadamia. You know, just figure out what's going to be something that you look forward to, that's got, you know, the mouth feel and the texture that you need for your food.
I think it's the witching hour now.
It is. Yes, thank you so much, Dr. Loeb.
But one last thing is our fearless leader, Mark Lichty, has some parting words.
Well, yes, thank you, Howard. And Stacy, this is remarkable. You have, I've seen a lot of people speak about this subject, but you have a way of reaching people, a balance that is very unusual. And, you know, while I started on this diet 18 years ago when I was first diagnosed, I did it further for the climate footprint issue, because on the plant-based diet, I have about 1/10 of the carbon footprint of an individual that's on a meat-based diet. So you're doing some profound good for my grandchildren too. And we deeply appreciate that. I wanted to remind all of those that are viewing that Dr. Loeb is here voluntarily. And not only that, Dr. Loeb, thank you for coming back for the question and answer. There's so many other things that you, not only were you here on your own time for the webinar, but you came back for the question and answer, which is way beyond the call of duty. And we really do appreciate that. So thank you for that. And now, by the way, I'm going to go out and get some nutritional yeast as well.
Well, I have some of that sitting in my kitchen, and maybe I'll just go down and put some on my computer or something. But
well, anyway, and I do want to be sure.
But I wish it was. Maybe the company should send me some free ones now.
Yeah, they should indeed.
Well, we'll see what we can do about that. But there's two orders of business here. One of them is, I think it's fair to say that we'll share your list of resources to the group. I had to put them in piecemeal in the chat because there's word limits. But I think when we publish this online, we'll include the resources. And the other thing is Martin wants to explain how you can save how people can save the whole chat. So Martin.
Yes, so if everybody looks at their chat, you should see at the bottom several icons. And if you look to the right, the bottommost right, there you'll see 3 dots. And if you click that on, you'll have an opportunity to save the chat. But if you can't do it for some reason, I've saved the chat. So just email me and I'll put my email address in and I will send it to you.
So I think that's a wrap for us now. Dr. Loeb, thank you so much. You're changing lives for the better. And we appreciate the fact that you had this time for us.